There are several appointments still available for the COVID vaccination clinic in Canton tomorrow at Lehman Middle School. But if you're pregnant, you'll need a prescription from your doctor that indicates you can get the shot. News 5's Jesse Schultz spoke with leaders at the health department about that requirement, one we are not seeing at other local clinics.
Sarah Tout is expecting her first baby.
I'm currently 23 weeks and 6 days pregnant.
And not only is she pregnant, but she's an OB/GYN at university hospitals. Day in and day out, talking to women about increased COVID-19 risks and whether they should get the vaccine. She says many are on the fence.
Certainly, none of the vaccines that are available have been specifically tested for pregnancy. So I can understand a lot of different folks, for a lot of different reasons, will have some very strong concerns about whether or not this is something that they can trust.
Not having clinical trials specifically for pregnant women is why Canton City Health is requiring a doctor's note for anyone who is expecting and also expecting to get a shot at their clinics.
So there is that caveat in that emergency use authorization that people who are pregnant should have a conversation with their medical provider prior to receiving the vaccine.
Health Commissioner Jim Adams says they're following CDC guidelines and will accept multiple forms of proof.
The most common is something that looks like a prescription or a doctor's order, but we have gotten emails, we've gotten letters, and we've accepted all of those as some kind of documentation that they had that conversation.
But both Tout and Dr. Ellie Ragsdale with UH says while there may be no clinical trials focusing on pregnant women, they've seen data in real time.
And that's mostly healthcare providers that were vaccinated back in December and January that were pregnant that we've been following out now for 5 or 6 months.
And out of those women,
we haven't seen any increased risk of pregnancy complications, no increased risk of birth defects, no increased risk of preterm deliveries, nothing. We also have women who were attempting to conceive, who were going through infertility treatments, who got vaccinated during that, who are now, midway through their pregnancy, who are also doing great.
Tout herself was fully vaccinated by the end of her first trimester.
It felt like I was doing the single best thing that I could do to protect my own health and my baby, because ultimately the best way to protect a baby's health is to protect the mom.
Ragsdale says when she's asked to sign off on a vaccination order, it's typically a yes, unless they have known allergies to vaccinations.
I think the best available data that we have right now suggests that the best thing a mother can do for her unborn child is get vaccinated for COVID.
For News 5, I'm Jesse Schultz.